Good afternoon, everybody. This is Dr. David Gross, and I'm a psychiatrist.
Hi, and I'm Dr. Andrew Rosen. I'm a psychologist.
And we are two shrinks and a mic. Today's discussion focuses on an area that has perplexed and, in some respects, tormented both of us. That is helping people sleep when they have sleep difficulties. It's become, at least from my perspective, at times a medication nightmare.
Yes, and a much underlooked and underappreciated origin of other psychiatric problems. Very often, if you scratch the surface with somebody who comes in presenting with anxiety or depression or both, you will find that they're not sleeping very well or much at all. And sometimes that's the result of the anxiety or the depression. Sometimes it's actually the cause of the anxiety and the depression, or at least exacerbates the problem. And over the years, I think we've just begun to start to appreciate the significance of sleep and its effect on the brain. And certainly it's something that mental health professionals we're much more aware of and should be asking questions about in that initial appointment when we start to evaluate what's wrong.
You know, if you think about human beings and living in our modern society and the degrees of stress and difficulties that are present, the two major biological effects of stress are stomach acid and sleep. And the sleep mechanisms are extraordinarily sensitive to stress. And unfortunately for both of us, that leads to lots of problems for the people that we work with. So it doesn't necessarily have to represent an underlying mental health, psychiatric, psychological disorder, but it can be the result of stress. And unfortunately, nobody educates the general population on sleep hygiene and how to deal with stress and also how to promote improvement in sleep. It's amazing how many people I talk to tell me that they watch TV, and then fall asleep. The old idea was back in the 1950s and 60s, I'm kind of aging myself, I guess, people used to watch the Jack Parr show and just so they could fall asleep. But the reality is the television has an inherent flicker. If you take a video camera, old-fashioned video camera, and videotape the screen, anything that you're watching, and then play it back, you'll see the flicker. But the human brain, the eyes aren't aware of the flicker, but the human brain is. That flicker is like a strobe light. It's too activating, and that's one of the reasons why watching TV before you go to sleep at night, regardless of what you watch, is the wrong thing to do.
You know, one of the problems is that people in general, I think, don't really appreciate the importance of good sleep. And I think part of that is that we've always taken it for granted. And very rarely, I think up until recently, very rarely does any medical person ask about a patient's sleep. It's usually something that will only be recognized when somebody reports and actually comes to a place or a doctor or a clinic saying that their sleep is poor. So why is it that people underappreciate the importance of sleep? Well, I think it's because it never really probably used to be a problem. I know years ago, I'll age myself as well, before maybe even people had TVs in their bedrooms, people would go to sleep, end the day in the living room, so to speak, and they go into their bedrooms, and if they were tired enough, they just turn the lights off and go to sleep. Or sometimes people would decide that they would read before going to sleep, which didn't have the negative aspects of what you just described with television, and that would be it. Today, it's completely different. People are multitasking until the very moment that they lay down in their bed, whether it's they're multitasking with their computers or on the telephone or what we call doom scrolling on their cell phones. And then they get into bed and then they try to fall asleep and they can't right away. So they pick up the electronics again or they watch TV. And all of these things are horrific when it comes to helping the brain get tired and let go and go to sleep. Years ago, this didn't exist. So I think people took sleep for granted up until recently, and now people are starting to realize that sleep is a big problem.
Well, we're real fortunate that we live in the modern era. I mean, can you imagine living in a cave in prehistoric times where you were worried about saber-toothed tigers and all sorts of predatory animals? We don't have that now, but we have the ability to sleep naturally. The concern about dementia, Alzheimer's disease has become a major preoccupation and a major health problem as the population ages. And impaired sleep can be a risk factor for the development of dementia, and can't be ignored. The ideal approach to the problematic sleep is stress control and sleep hygiene. And sleep hygiene is really not complicated. Many of you all have heard the guidelines, which are very simple. A dark room that is not going to distract you with light because the eyes and the feed directly to the brain. If there's any ambient light, a room that's cool enough so that you can be comfortable, and a quiet room. All that is very, very helpful to promote sleep. I generally recommend that there be a break between, as you said, Andy, the doom scrolling and going to sleep. I urge people to spend time reading a magazine or a book to get out of their own heads, because all of us, when we go to bed at night, are probably thinking about the next day and getting stuck in overthinking or catastrophic thinking mode. So anything you can do to get yourself out of your head, which does not include watching television or getting on the computer, can be helpful. And that's why I recommend a book or a magazine for maybe a half hour to an hour before you go to sleep, because the brain wants to naturally calm down and slow down at that time of night, and reading a book or a magazine, it allows the brain to do that naturally.
One of the problems that people have is that when they do get into bed and things are quiet, if there's no stimulation, they start to get restless. So either the person might look for that external stimulation, such as the computer or the phone or the TV, or they go internal. And that's where we've talked about over the last few weeks, the whole issue of overthinking. So if you're in a room and it's quiet, and all of a sudden all of the noise of the day and all of the stimulation is gone, it's a very sudden change. And then you're faced with the uncomfortability of silence. And that is what leads to going internal and overthinking. Years ago, they did studies with sleep deprivation, and they found that when they would intentionally, in experimental studies, deprive a person of sleep, the brain would start to create its own stimulation, even in the form of hallucinations and delusions, if they had enough sleep deprivation. So the dilemma is for the people in 2025, how do I go from hyperstimulation and multitasking to all of a sudden dramatic silence? It's like everybody shuts the sound and the lights off. The brain needs a transition period, and that's where what you just described in terms of sleep hygiene, it needs a period where it's kind of like when I'm on the treadmill. If I'm going at a fast pace on the treadmill, I don't just push the stop button. There's a winding down period. We call it a cooling off. We understand that for the body, but the brain also needs it. So how do you do that cooling off period for the brain? Yes, reading. I'm a big fan of mindfulness meditation, which is a great transition because you're actually listening to something, but it's all in the service of helping the brain cool down and reduce stimulation and get into a calm state. And then the person has a much greater chance of naturally falling asleep.
Sleep difficulties, as we've seen in the people that we work with, fall into usually three components. There can be difficulty falling asleep. Most common cause for that, at least from what I've seen, is individuals who have a busy head. They can't turn their brain off. That keeps them up. Occasionally somebody will say, my head's not busy, but I'm just not tired. I can't get ready for sleep. So difficulty falling asleep is a very common component of sleep difficulties. And the next difficulty is what we call middle of the night awakening, where you fall asleep okay, but then 2 or 3 hours later, you wake up. And people oftentimes wake up and have a busy head. They suddenly start thinking about all the things they have to do, and the busy head then gets in the way. A lot of people will wake up in the middle of the night because they have to go to the bathroom. Most of the times they can go back to sleep right away, and that's not a major interruption of the sleep cycle. And then finally, there's early morning awakening where somebody gets up at 3, 4 o'clock in the morning instead of 6 or 7 and can't fall back asleep. So as we think about the medications for sleep, we need to determine whether there's a need for medication that's going to last the whole night and help somebody stay asleep versus a medication that's just really geared for individuals who have difficulty falling asleep. Many of the common new age, quote unquote, medications for sleep like Ambien and Lunesta and others are really geared towards helping somebody fall asleep. But if there's middle of the night awakening or early morning awakening, these agents oftentimes aren't as effective. So there's a lot of thinking that goes into what kind of medication to take. And the biggest problem with all these medications is that individuals will get a period of insomnia, get on a medication prescribed by the family doctor or psychiatrist or nurse practitioner, for example, and 10 years later they're still taking it, which is really not necessary and leads to more difficulties. We'll be talking about that some more as we continue to have this discussion. But medications can be very helpful, but they have to be used with a clear-cut plan.
And unfortunately, if you go to the pharmacy, you see probably the most popular aisles are, as you mentioned, one gastrointestinal. So you see all kinds of medications for the gastrointestinal tract. And then the other is sleep aids. And you don't need a prescription. You don't need to see the doctor, but you can take a sleep aid, usually has Benadryl in it of some sort, or people are using melatonin, and not used appropriately. But people become very obsessed and worried about not sleeping and look for a certain quick fix every night to make sure they sleep, because if they don't sleep, it creates a cycle of anxiousness, worry, stress about not sleeping, which then obviously keeps a person from sleeping, and then they look for the quick fix in the pharmacy. So it's very important that people actually learn about the more healthy ways of learning how to interfere with sleep problems, such as learning about sleep hygiene and learning about other things like what's important in general to stay healthy and to help the brain fall asleep at night. The things we've talked about: exercise, eating appropriately, not eating right before you go to bed at night, or not exercising before you go to bed at night, or not engaged in certain other activities. Now, I just have to add another kind of new development that I've seen, probably a function of a little bit out of COVID and people having working from home and different schedules. There's a lot of people who are deciding they like to stay up all night, and they may be up at night till 4 or 5 in the morning and then sleeping during the day or taking naps during the day. Lots of people prefer night being awake and day sleeping, which is really unhealthy because of all of the effects on cellular issues and health issues from, vitamin D deficiency and everything else. So educating the public about sleep and the importance is really essential, and that's what we're trying to do today.
Plus, the sleep-wake cycle is something that is conditioned. So, for example, our brains are normally conditioned to getting us to sleep when it gets dark out and waking us up in the morning when it's light. Makes sense for most people. But if you go through a period of days or even weeks of reversing the sleep-wake cycle and going to bed, late at night, early in the morning, and then waking up later in the day, you have reprogrammed your brain. And it can become a bear to try to get people to reprogram them back. There are now techniques and cognitive behavioral approaches to this where you actually have to gradually reprogram the brain to get back to a normal sleep-wake cycle. But the reality is that sleep is more than just feeling good during the day and feeling refreshed. We now know that the brain resets itself at night, and a lot of metabolic, healthy actions occur at night. There's some thought that memories are encoded at night, and the brain is kind of like a computer. When we're often told if your computer's not working well to reboot it, restart it. Same thing with a phone, cell phone. That just resets the software, and the brain does the same thing at night. It basically resets itself, and that's healthy. So individuals who have impaired sleep at night are depriving their brains of the normal process of getting healthier and resetting itself. And that could become real problematic and impact more than just feeling tired during the day, but can lead to cognitive issues, memory issues, judgment issues, coordination issues, and a whole host of difficulties. And so if sleep is problematic, it's important to speak with your health professional to address it and also to look for possible etiology for it.
And there's certain populations that are more susceptible to sleep problems. For instance, youngsters, kids in high school who are having tremendous amount of work, and college kids, all kinds of studies that show that they really are very sleep deprived in terms of not getting enough sleep. Like I think the guidelines are typically around 7 to 8 hours for good, healthy, restorative sleep. And very often kids in high school are getting maybe 5 hours sleep. Some of it may be because of non-academic activities, but a lot of kids are having sleep issues that way. Years ago, I was a consultant for the Federal Aviation Administration and would be examining air traffic controllers, and they really were susceptible to sleep problems because they could be on a day shift for 3 months and then all of a sudden be on a night shift for a month. And it was very difficult for the brain of these people to make those kind of adjustments. So the incidence rate of insomnia and anxiety and stress disorders was pretty high. I think they're more attuned to that issue now so that it's not so much of a problem. But certain populations who are not blessed with the idea of getting up early in the morning and getting to bed by 10 or 11 at night are more susceptible to these problems. And these do lead to the kinds of other problems that you and I see in the office, such as anxiety or stress or irritability or just an overall dissatisfaction with how life is. They're just not getting that kind of restorative sleep.
Well, you know, they've done studies on teenagers and high school students in sleep labs, and they've determined that in reality, a high school student should be able to get up at 10 o'clock in the morning and start the school day then. That's when their brain is best geared for learning. Unfortunately, you know, you've seen the high school kids who have to be in school by 7:30, 8 o'clock in the morning, which actually goes against the grain in terms of the healthy circadian rhythm. And then, as you said, they've got so much work to do, they don't get to bed until real late. And the reality is that most teenagers probably need 8 to 10 hours of sleep a night to get that kind of brain resetting and comfort level in restorative sleep. So it's a real significant problem. One of the things I wanted to mention before about over-the-counter agents is that people don't realize that the bulk of them have like antihistamines, Benadryl, one of them, and a whole bunch of others. Antihistamines naturally block the chemicals in the brain responsible for memory storage. So individuals over the age of 65, for example, antihistamines can impair memory during the day, and there's actually studies suggesting a correlation between dementia and regular use of high-dose antihistamines. And so you have to be careful. The cold pills have antihistamines, and that's why when you take a cold pill, the next day you feel kind of fuzzy-headed and not as well as you'd like to. So taking antihistamines at night and many of these over-the-counter agents can make you feel fuzzy-headed during the day. And if you go to a sleep lab and look at the brain waves in somebody who's on antihistamines for sleep, you'll not see the normal cycle of slow waves and REM sleep, which is dreaming sleep, that you expect to see.
Tell me about it. A few weeks ago, I went to the pharmacy to get some Advil, and I was in a hurry and didn't realize I was getting
Advil PM
with the Benadryl in it, and I couldn't understand why I was so tired that day and just fuzzy-headed, just like you described. And I'm, what's going on here? So I got out the Advil to see if I had made a mistake, and sure enough, Benadryl was in it. So I don't know how people take that every day. That's just really bad for the brain.
Well, you know, the other thing I see is people will get on a cold pill or an allergy pill, and there's a little D after the pill. D stands for decongestant. And the decongestant in most of these cold pills is phenylephrine, which is basically like speed. And if you want to interfere with your sleep, you know, take these agents close to sleep at night, and it'll just keep you wired and keep you up all night long. But one of the things I think we can't end our discussion today unless we talk about is the concept of phobic anxiety developing because of insomnia. Both of us have talked about how tough it is for individuals who have gone through a lengthy period of insomnia or poor sleep. It's horrible. It's like torture. And just the memory of not being able to sleep and worrying at 6 or 7 o'clock at night if I'm going to sleep tonight is horrendous. And so when they finally get an agent that helps them sleep, they're going to do anything they can to avoid getting back into that horrible, torturous, insomnic period, which is why people end up staying on sleep medicines for years when they really didn't have to.
Yeah, the question is always, what if I can't sleep tonight? And as soon as that question comes up, it creates a stress and a worry, which is the opposite of what you want before you go to sleep. You want to have the feeling of, oh, I'm so tired, I will fall asleep. And sleep is a natural process. I don't have to try to sleep, it just happens. Once you develop any kind of repeated episode of insomnia, you do start to worry about it, which really makes the problem much worse.
I've seen lots of individuals who have been on sleeping medicines for years, and the reality is that probably after the first 2 to 4 weeks, those agents are no longer helping them sleep, unless it's a very sedating agent that continues to put them to sleep. So they may be sleeping naturally while still taking this agent, and many of the agents, because they condition the brain into experiencing the sedating, numbing effects that these medicines have on brain cells, if you've been taking it for weeks or months or even years and suddenly don't take it, you're going to have rebound insomnia. And people don't realize that it's rebound insomnia. That is, it's a direct effect of being off of the medicine rather than a return of your insomnia. But most people conclude, uh-oh, here comes my problem again. I need to get back on my medicine. And before you know it, they're going to be on it for another 10 years. And it's a shame because these agents can be helpful when they're used in the short run, but can be potentially problematic in the long run.
And there's another aspect of that where people who do take the medicine to sleep, as soon as they take the pill, there is a placebo effect there where they feel relieved. Oh, I just took the medicine. That's going to get me to sleep. So it takes the pressure off. Even if the pill was not actually a sleep agent, a certain percentage of people would actually fall asleep because they feel like they've done something to gain control over the insomnia.
And it becomes a rabbit's foot. You know, I can't be without my Ambien, for example. And it's similar to people taking tranquilizers, we call them benzodiazepines during the day. It becomes so important that you can't be without it. And half of the work that we end up doing is educating individuals as to, you've probably been sleeping fine all these years and haven't needed it, but we have to decrease the medication very gradually, because if we do it too quickly, your brain cells will rebel and artificially keep you up and interfere with sleeping. So, you know, if somebody's on 10 milligrams of Ambien and you cut it from 10 to 5, for your brain, that could be too abrupt and drastic a change, and we may have to decrease it much more slowly and in a much slower decrement than initially planned.
Just one other thing we should mention is the concept of sleep apnea, because a number of patients have what we soon find out is sleep apnea, and that does have an impact on sleep as well. So sometimes it's important to send people to one of these sleep labs to see if indeed that is another component of dealing with sleep issues.
You know, and it's much more common than people realize. A lot of people will be told that they snore, but when there's lots of snoring, you have to ask if there's also gasping for breath and coughing and choking. And sleep apnea is quite serious in terms of the medical risks that it can create. There's a correlation between sleep apnea and high blood pressure, atrial fibrillation, including weight gain as well. The brain is not happy if it gets deprived intermittently from oxygen, and that's what sleep apnea creates. On top of that, there can be an impact upon the sleep-wake cycle, and if you interfere with the sleep-wake cycle and your sleep architecture is impaired by waking up frequently during the course of the night, you're not going to have the restorative sleep and all the metabolic mechanisms that need to occur during the course of the night's sleep, and you're going to suffer because of it.
Well, I know we've discussed a lot of information today about sleep, and I hope that it was informative. It's really important for people to not underestimate the role of sleep in their well-being, both physically and mentally. And certainly if anybody out there has any questions or needs more information, you can email us, and we'd be glad to help you out with that.
And I think it's time for a nap. And this is Dr. David Gross, psychiatrist.
And Dr. Andrew Rosen, psychologist.
And we are two shrinks and a mic.
Have a good day.
And a good nap.
The Two Shrinks and a Mic podcast is for informational and entertainment purposes only. The views expressed are those of the hosts and guests and do not constitute medical, legal, or professional advice.
Please always consult a qualified healthcare provider before making any medical or wellness decisions. Our content is not a substitute for professional medical guidance, even though our mothers tell us we have the best advice possible.